you treat? Do you see a lot of, especially surrounding women's health?
So a lot of the conditions I see is, of course, those hormone imbalances that women have, um, PCOS, endometriosis, PMS, fertility is huge, and any like menopause too, hot flashes, insomnia due to menopause. I also see people who have thyroid issues. It's more and more prevalent that people are having thyroid issues, which is causing infertility issues. And then I also see some patients with gastrointestinal issues, which in naturopathic medicine we think the stomach, your digestion is really can control your whole body. And so getting to making sure that you're digesting well, so you can absorb those nutrients, so we can use everything we eat and kind of heal ourselves. That's the roundabout way to say it.
All right. And you want to share how we work collaboratively?
Yeah. So here at Push, I think that whole idea that Deb and I had when we first started kind of working together and kind of coming together at Push, is that Deb and I, we talk about each case with each other that we have with each other, and we kind of, Deb will see the patient more frequently than I will, because I will see some like once a month usually. And then we kind of we'll build our ideas on top of each other, kind of knowing Chinese medicine has a unique perspective on how to look at things, but it also tells me a lot of things, because we did have to learn a bit about Chinese medicine, but Chinese has more the Eastern look, and I have more the Western look. And when we come together, it makes it faster, and it could be faster and a better approach to actually healing the body and getting people pregnant. what we do here. And I mean, our bodies are naturally supposed to get pregnant. So I think through the approach of the body healing itself through naturopathy, and then getting that Chinese look too. So Deb, if you could tell us more about Chinese and how it works, you work.
Well, what I would say is that I'm so much more than an acupuncturist.
Mm-hmm.
Chinese medicine, but I also use all my skills as a doula, as a childbirth educator to, really we created this sanctuary for pregnant women. And so what I do is put the body back in balance. So typically I see a lot of fertility, weird pregnancy, high risk pregnancy issues, and postpartum. And so the way that we diagnose in Chinese medicine is, one is we look at the tongue. So the tongue is the only muscle you can see outside of the body. So it helps you get a good understanding of your internal state of health. Mm-hmm. And then we also feel the pulse with 3 fingers on each side. And it relates to 12 main organs in the body. So what we're feeling for is more than just the rate. It's there's 28 specific pulse qualities that we learn, and they each relate to different things. So we're looking for, everyone has an inherent weakness. So where is the weak link? And then one of the pulses might be like boom, boom, really strong. And so where they're weakest and where their bodies are excess. So we're going to strengthen where they're weak, sedate where it's excess, and the body goes back into homeostasis. So it's really awesome how we're able to help a lot of people who come in crying, honestly. We see so many people that like have just been told they never can have a baby, or bleeding issues. I see so many bleeding issues, people going through menopause or whatever, wherever they are, PCOS, bleeding for 2 years, bleeding for 6 years, clots the size of limes or apples, I hear. And within 1 month, their bodies are shifting. It's like if they're too cold, they start warming up. And if they're too hot, they start cooling down, like whatever it is. So we can use acupuncture, acupressure, moxibustion, Chinese herbs, lifestyle. We do a lot of guided meditations and calming things, ear seeds. Mm-hmm. It just goes on and on. So I absolutely love that we co-created this awesome center. Mm-hmm. And our goal is really to help as many women as we can, and as many families as we can, and really make a difference in the world.
One thing I love doing, Deb, with you is when we have a patient that's like, we're both seeing. And I'm thinking one thing based on the symptoms, and I come and I talk to you about that patient, and you're like, "Yeah, I saw that on that tongue, on the tongue, and her pulse was exactly that." And I'm like, "Oh, yes!" It's so great how like we really can work together, and we kind of see the same things that people have kind of missed through their workup that they might have had somewhere else.
Absolutely. And people are getting pregnant that were having issues before, and
Yeah.
resolving those issues. So it's really an honor to work with you, and thank you for your time today and
Thank
sharing.
you for having me.
Absolutely. Thank you. Bye, everyone.
Bye, everyone.